Hey there. Imagine you eat something that looks and tastes perfectly fine. A few hours later, you start feeling weak, your eyelids droop, and suddenly, you're struggling to breathe. What's going on? You could be dealing with one of the rarest but deadliest illnesses out there, botulism. Scary, right? Welcome back to Health Simplified with Opeoluwa. Here, we tackle complex health topics and break them down into simple, easy to understand stories. Today, we're diving into botulism, a serious condition that's rare but life-threatening. Stick around as I explain what it is, how to prevent it, and how to stay safe. Botulism is a rare but serious condition caused by a powerful toxin produced by the bacteria Clostridium botulinum. According to Adams et al., 2024, Heilman et al., 2024. This toxin disrupts the communication between nerves and muscles, leading to weakness, paralysis, and potentially life-threatening complications if not treated promptly. In today's video, I'll simplify what botulism is, how to recognize its symptoms, and the steps you can take to protect yourself and your loved ones. Stay tuned. Let's start with the basics. Botulism is caused by a toxin, a powerful poison produced by a bacteria called Clostridium botulinum. This bacteria loves places with no air, like sealed jars or cans. The toxin is super dangerous. Just a tiny amount can block your nerves from telling your muscles what to do, which can lead to paralysis. That's when your muscles stop working, and if it gets to the muscles that help you breathe, it can be life-threatening. Botulism doesn't hit all at once, it starts sneaky. At first, you might feel weak or have a dry mouth. These symptoms can seem harmless. But soon, you might notice drooping eyelids or trouble focusing your eyes, bilateral cranial nerve palsies. Weakness that starts in your face and moves downward to your arms, legs, and chest, symmetrical descending paralysis. In severe cases, it can stop your lungs from working, making it hard or impossible to breathe on your own. These symptoms are what make botulism so dangerous. So, how does this happen? There are three main ways people can get botulism. First, foodborne botulism. This happens when you eat food containing the toxin. Foods that aren't canned or preserved properly, like homemade pickles, are often to blame. When Clostridium botulinum grows in the food, it produces the toxin, and you ingest it without knowing. Wound botulism. If the bacteria get into a deep cut, they can grow and release the toxin directly into your body. This is more common in people who inject drugs with unclean needles. Infant botulism. Babies under 1 year old can get botulism if they eat honey. Their tummies aren't strong enough to kill the bacteria, which can grow and release the toxin inside them. Et al., 2024. Diagnosing botulism isn't always easy because it can look like other illnesses, such as strokes or certain types of poisoning. Doctors usually look at your symptoms and ask questions about your food history or any recent wounds. They might also test a stool sample to confirm if the toxin is present. Adams et al., 2024. It's important to act quickly because this condition can get worse fast. Here's the good news: botulism can be treated. Doctors use something called an antitoxin, which stops the poison from causing more damage. It doesn't reverse what's already happened, but it can keep things from getting worse, according to Heilman et al., 2024. If the toxin has affected your breathing, you might need a ventilator to help you breathe while your body recovers. The recovery process can take weeks or even months, but with the right care, most people make a full recovery, according to the study carried out by Nikiforov, 2024. Prevention is the best cure. Here are some simple steps to avoid botulism. White tick mark: don't eat food from cans or jars that are bulging, leaking, or smell bad. White tick mark: if you're making homemade canned foods, Follow safe canning guidelines, like using a pressure canner for low-acid foods. White tick mark, and remember, never give honey to babies under 1 year old. These small habits can go a long way in keeping you and your family safe. Botulism might be rare, but it's no joke. It can be deadly if left untreated, but the good news is that it's preventable and treatable if caught early. So, the next time you're in your kitchen or looking at food labels, remember these tips and share this video to spread the word. Knowing about botulism might just save a life. Thanks for watching. Don't forget to like, share, and subscribe to Health Simplified with Opeoluwa for more simple, clear explanations of health topics that matter. Stay safe, stay informed, and I'll see you next time. And don't forget to subscribe.